When the Supreme Court protects the health of millions, the preventive care insurance battle isn't over. If you believe that basic access to preventive health services, like cancer screenings or HIV prevention, is a given, you might be among the lucky ones. But for over a year, the seemingly obvious right has been under serious legal threat. And it wasn't until the end of June 2025 that a landmark decision by the U.S. Supreme Court finally provided an answer. Americans will continue to receive free preventive care coverage from health insurers, for now. 1. A quiet battle between healthcare policy and constitutional law. The issue began in 2020, when a group of business owners in Texas sued the federal government, arguing that the Affordable Care Act, ACA, specifically its requirement that insurers fully cover preventive care services, was unconstitutional. At the center of the lawsuit was the role of the U.S. Preventive Services Task Force, USPSTF, a panel of medical experts not appointed by Congress, yet with the authority to mandate insurance coverage based on its recommendations. In a major ruling, the Fifth Circuit Court sided with the plaintiffs, declaring that the USPSTF lacked constitutional authority. This opened the door for insurers to stop covering dozens of preventive services, including breast and colon cancer screenings, hepatitis vaccinations, and HIV prevention drugs like PrEP. In June 2025, the Supreme Court overturned that decision. In a 6-3 ruling, the justices affirmed that the ACA's preventive care mandates remain valid and enforceable. This wasn't just a legal victory. It was a clear defense of public access to affordable preventive health care. 2. What was at stake? The consequences of losing free preventive care. Preventive services are a cornerstone of modern U.S. healthcare policy. Under the ACA, more than 150 million Americans, mostly working adults and their families, benefit from free access to essential preventive services, including screenings, vaccinations, and health counseling. Had the lower court's decision been upheld, the consequences could have been dire. Soaring out-of-pocket costs. According to the Kaiser Family Foundation, Americans might have faced hundreds of dollars annually in new costs for services that were previously free. Plummeting screening rates. Even a $20 copay increase can reduce preventive screening rates by up to 40%, based on health behavior research. Disproportionate impact on low-income and minority groups. These communities are most vulnerable to health disparities and least able to absorb added medical costs. 3. What the Supreme Court said and why it's a turning point. The Supreme Court didn't just reinstate a popular policy. It sent a strong signal. The federal government can mandate insurers to cover services recommended by expert panels, even if those panels weren't confirmed by Congress. This ruling not only preserves current preventive coverage, but also paves the way for new recommendations in the future, such as AI-powered cancer detection, genetic risk testing, or future vaccine protocols. Still, the court's opinion was technically narrow. It didn't fully resolve all constitutional questions about the USPSTF. That means future legal challenges are still possible. 4. Who wins and who faces new pressures? The public, a clear victory. Patients keep access to free preventive care services. Lower out-of-pocket expenses mean higher early detection rates and reduced deaths from chronic diseases. Health insurers, relieved but cautious. In the short term, they must continue covering all mandated preventive services. But many insurers acknowledge that preventing illness is cheaper than treating it. Over time, this may reduce claims and improve outcomes. Firms like United Health, Cigna, and Anthem express support for the ruling, while also advocating for shared cost models or premium adjustments. Pharma and medtech companies, big winners. Gilead Sciences, maker of HIV prevention drug PrEP, saw its stock rise over 3% after the decision. Exact Sciences, which produces colorectal cancer screening kits, surged over 6%. Financial markets responded positively, betting on the long-term stability and expansion of the preventive care sector. 5. The financial question, who will pay? Though the intent is clear, investing in prevention to save costs long-term, there are still financial concerns. Rising demand means higher short-term costs for insurers. Newer preventive services like genetic testing and AI-powered screenings are expensive to implement. Insurers now face a complex decision. Should they raise premiums, narrow their provider networks, or find new cost-sharing methods? The result could be a more tiered insurance market, much like education or housing, where better preventive access depends on your plan level. 6. The political dimension of preventive care. This decision highlights the growing ideological divide. One side views preventive health care as a basic human right. The other sees it as a market issue, arguing that government mandates harm private enterprise. This legal battle may be resolved for now, but political fights are far from over. With the 2026 elections approaching, preventive care is likely to resurface as a central policy issue. A shift in the balance of power in Congress or the Supreme Court could easily reverse today's win in the future. 7. Conclusion. A hard-won victory, but the fight continues. The Supreme Court's decision is not just a win for preventive care. It's a powerful reminder that law can be a shield for essential rights when society demands it. However, this legal clarity is only temporary. Future lawsuits, changes in political leadership, or reinterpretations of the ACA could reopen this debate. The path forward lies in collaboration between policymakers, insurers, and the public to build a sustainable healthcare model, one where preventive care is seen not as a luxury, but as the first and most cost-effective line of defense. If you found this topic important, drop a comment below. Have you ever benefited from free preventive services? How do you think we should fund preventive healthcare going forward? Don't forget to subscribe for more deep dive insurance insights every week.